My name is Toni Gittles. I spent the first 35 years of my life as an audiologist, so I come from a non-medical healthcare profession. I was also an instructor at Baylor College of Medicine, so I've worked with physicians. And it's been helpful whenever I'm in the hospital with my mother or the emergency room. Also, at one time I owned a hearing aid manufacturing company with my cousin, and that was in Longwood. It's no longer there, but we had that company for about 25 years. But more important than that, I've been a caregiver for 10 years to my mother, who is currently 97 years old. And she keeps, at every birthday, she goes, "I'm how old? Are you sure?" So I do the math, and we figure it out. And she goes, "Wow, that's amazing." Unfortunately, my dad died 25 years ago. I really didn't think Mom would do as well as she could, as she has been. But with my support, I know that's been an important factor. My being there by her side, managing her health, her financial issues. It's been an experience for both of us and a journey. And she has a good quality of life, which I'm very proud of. I'm scheduled to have a total knee replacement on Wednesday. So I'll be the one in the hospital, and I'll be the one needing some care. Mom is very sad that she's not the one that's going to take care of me, of course, but I'll be taking care of her remotely with my phone, and I'll have other caregivers when I get home from the rehab center. So it'll be another experience to talk about. We're here today to talk about in-home caregiving services. It may or may not be familiar to you. You may be more familiar with home health care services. We've got 3 objectives for today. One, that you'll be able to identify individuals, perhaps in your practice, that can benefit from in-home care services. Second, to describe exactly the kind of services that are available to you by home health care agencies, and to understand the value that having that service available to your patients or to your clients will provide. And it's huge, and mostly I'm speaking from experience. And I wish I would have known all this 10 years ago when I started my journey with my mother. So part of my passion is getting the information out, especially to hearing healthcare professionals and physicians. Because throughout my journey with my mother, which was numerous hospitalizations, numerous times in rehab, numerous emergency room visits, numerous doctor visits, not a single soul offered a brochure or a resource on in-home care services. And I'd like to change that, because this is critical, especially as the baby boomers age. We've got a huge aging population. We have people with chronic illnesses. And obviously, Mom's 97. I might go to 110. I don't know. I need to know this information. There's a website, RosalindCarter.org. Is anybody familiar with that? Yep, it's our former First Lady. She's been involved in the area of mental health and caregiving for many, many years. This is a wonderful resource for you. In fact, she has a resource page of over 100 organizations that can provide information about specific illnesses and diseases, as well as caregiving resources. So I invite you to check that out. This is from the website, from her executive director. This is the Rosalind Carter Institute for Caregivers. We are facing a crisis in the United States. Our aging population, increased longevity, and the growing burden of chronic illnesses escalate the need for caregivers. Caregivers need support and community programs to help them remain healthy and to maintain them being able to care for others. I've found several articles and studies about caregiving over the last decade, so I'm going to give you some statistics just to blow your mind about what a crisis this is. This was back in 2004 from another website which I would recommend, the National Alliance on Aging, and they have a caregiving section. They reported in 2004 a very extensive survey that the typical caregiver in the US is female, about 61%, approximately 46 years old. She does have at least some college experience, 66% had college experience, but here's the thing. She spends an average of 20 hours or more per week, not month, per week, providing unpaid caregiving to someone who is 50 years old or older. That's huge. The majority of caregivers are married. I am not. It can be a burden to be married and be a caregiver, but it's also kind of lonely at times because there's no backup system immediately available. And that's why an in-home agency that is my backup is very useful. Most of the women caregivers have juggled their work careers with their caregiving responsibilities. Now that was back in 2004, but I don't know that it has changed that much with the recession, with more people out of work. Perhaps the figures are different, but it gives you some impact. And if you have clients or patients that fit this criteria, perk up and maybe ask some new questions that you haven't asked before. And one question that I have been asked is, do you need any help? Well, that's pretty general. Do I need help? Yeah. What do you need? I don't know. What do you do? What have you got available? It helps to go into some of the detail that we're going to go in later. I'm still learning new things about caregiver services. I'm learning I can hire a travel companion, and Mom and I can actually go on a trip and make it easier for me. I'm learning that there are services for people that were in the hospital to make sure they're not readmitted, make sure they're compliant with their doctor's orders, following their medication schedule, whatever the recommendations are. I know I can't count on my mother to follow her recommendations. She's been in physical therapy on and off for 10 years, and if the therapist isn't there, does that pile of exercises that they've all left us over time get done? Not unless I help her. And I don't want to get into an argument with her. So I've backed off a little bit. That's not the support she wants from me. So 2004, how many caregivers are in the US? These are estimates, but across some of the surveys, 44.5 million people were caregivers. These are people age 18 or older taking care of people age 18 or older. This is in the US. That translates to 21% of the population. It's getting bigger because I have some dates from 2009. So we've jumped 5 years. We went from 44.5 million to, anybody guess? 66 million caregivers. They're taking care of parents, relatives, spouses, and children, and actually I know people that aren't related taking care of each other, neighbors taking care of neighbors. There's a big need. Last mind-blowing statistic, the estimated economic value of their unpaid contributions was approximately $450 billion. And that was 2009, up from $375 billion in 2007. So it's increasing, and you know, this justifies certainly the need for all these agencies that are now providing caregiving type services. There's a lot of value to providing in-home care. When you think of in-home care, I haven't really defined it yet, but obviously it's caregivers that come to the home. Now, I thought they only came to the home, and I learned several years ago that they will go to an assisted living facility. I thought if my mother was in an assisted living facility, which she is, that she would have all the care she needed. Well, there are different levels of care that cost more as you go up and up the levels, but I found that what she wanted was somebody that would spend 3 hours with her in the morning when she was weak and didn't get her strength yet, and she loved the attention. Every need that you can think of, everything you do in the morning is what that caregiver helps my mom with. She's somewhat independent, but having someone there to make sure she doesn't fall, because she's high risk for a lot of different problems. We started this extra caregiving service after she was hospitalized. The second time, very seriously, and almost died. And she was very insecure when she got back. Well, there's value for the individual getting the care, but there's value for the caregiver, the family caregiver as well, possibly even more important. I haven't had a vacation in 11 years, except for an overnight stay in Chicago on 3 different times. But I was in a hurry to get back. After all, she's aging. Every day is a new day. It could be a new problem. There are 2 types of home care. There are 2 categories. One you might be familiar with, which is medical home care. So that's skilled nursing, physical therapy, occupational therapy, speech therapy. My mom's had all of that when she was at home, and she's also having that now in the assisted living facility. Non-medical home care is what I'm going to talk about. The difference is, let me give you an example. Well, the goal, first of all, is that both types of home care have the same goal: to keep that person as healthy as possible, to keep them safe. Very important for my mother, who is at risk for falling and accounts for most of our emergency room visits and visits to wound care doctors, and to enjoy the best quality of life possible. So, for example, a home health care nurse might come and adjust prescriptions, the medications. But a non-medical caregiver would make sure they're taken on the appropriate schedule. So they're not involved in ordering. They would do what probably any one of you would do. Another example, a physical or occupational therapist may design an exercise plan, which I was on after my, did I mention hip replacement surgery? But it was up to me to do the exercises every day. But this is where a caregiver can come in and especially help someone elderly. Now, a lot of my examples are going to be related to seniors because that's been my experience, but there are other types of individuals that can benefit, and I'll talk about those in a minute. Home health care services, finally, are usually temporary. Like my insurance runs out at some point. I have a certain number of visits. For Medicare, my mom seems to be in therapy all the time, and it seems to be okay. But people do need to check their insurance policies to find out about that. But again, those services are usually temporary. They usually end. The person gets to a certain level of performance, and then they're not needed anymore. An in-home caregiver, however, could be a 24-hour live-in person. So it's up to very short, very small types of activities to in-home live-in care. So let's take a look at some detail. Oh, I said I was going to talk about, so seniors comes to mind. Does it come to your mind as well? Maybe you've had grandparents or you have parents that were ill, and so you've had a little experience with that. You know, I've met a lot of older people, like I know a lot of 80 and 90-year-olds. Both spouses are living, and you know what? They're taking care of each other. And it's not easy. It looks very difficult from where I'm sitting. So those are types of people we should consider. There's families who have members with disabilities or special needs. Next example, people recovering from surgery and rehabilitating. Or it could be from an illness, like my mother, or an accident. Military personnel, families with military personnel. So get you thinking maybe about the clients that you see and that are walking in. We have a handout. We have a handout for you with that information, and that's what I'm going to talk about next. So how can FirstLight Home Care help you? I've been on a number of different websites, as well as used a number of different caregiving services as my needs have changed and as I've met people out in the community or gotten referrals. I'm going to tell you about FirstLight Home Care because it will give you a basis for comparison for all of the other sites, and it'll give you an idea what questions you should ask to compare the information. But one of the most important things that I've found about these companies is that it's nice to know the owner. It's nice to know the person that's going to be giving the care, to be introduced to that person and see if there's a match. And then there's agencies that really try very hard to match the caregiver's experience to what is needed and what is requested. So that's important too. Most of the people are quite well trained, but that's something else you can ask about. So there's different types of care: companion care, personal care, and I believe that's what's up here. That's primarily what we're going to talk about next. There's respite care. Hey, I could use that. Really? I could take a vacation. I think that's my next one. Dementia care. My mother is entering that domain, so we may have to look into that. It's very similar to the personal and companion care, but it will be a unique, specialized program determined by interviews with the family and the individual if they can participate, and everybody will understand and know what services are being provided. There's rehabilitative care, reducing hospital admissions, travel companions, and 24-hour live-in care. Let's look at companion care, or let's look at personal care services first. And how I want you to look at that is to go into your life. You can close your eyes if you want, or you can just think with me as I take you through your morning. What's the first thing you do? You're in bed, right? You got to get out of bed. I'm looking at you, and you probably can. But it's difficult for an older person. It was difficult, it's going to be difficult coming off of knee replacement surgery. So I may need someone to help me get out of bed. Boy, we haven't even gotten going yet, and I already need assistance. What do you do next? Okay, the bathroom, right? How far do you have to walk to the bathroom? I'm looking at you, and you don't need any help. But does the person need a walker? Do they need a wheelchair? Do they need to be taken to the bathroom? Do they need to be lifted off the bed into a wheelchair? Do they need a portable bedside toilet to use? So many things. We haven't barely gotten out of bed and headed toward the bathroom at this point. And then there's toileting, and there's bath hygiene, and there's showers, there's sponge baths, there's incontinence care. And boy, have you ever looked at the products that are available for that? Choosing the right one can take some time and money. What if now the person has gotten the bathroom duties done and it's time to get dressed? Can the person dress themselves? Can they put their shoes on? Where are their clothes? My mother had the worst accident of her life trying to get into the closet to just take down a blouse that she wanted to wear. Fractured her right ankle and was in a cast for 7 months. Guess what? More care. 2 people had to get her to the bathroom after that. I don't know how she got through it. This is a strong woman. You need to meet my mother sometime. Okay, we're dressed. Well, for women, it's makeup time. That gets harder as you get older. Our caregiver puts on her makeup, puts on her jewelry, selects her jewelry, and gets her ready for the day. And you know what? My mom looks classy every day. Before she goes down for either breakfast or dinner or lunch, she's ready to go. She looks better than I do. What about meals? It's not only about eating, it's going to the grocery store, it's preparing the meal, it's going into the refrigerator, the cabinets, getting your dishes out, eating, washing dishes, replacing them. You see, these are things we don't even think about anymore. But I've watched my mother go from needing no care at all and managing a very large home and her finances at age 87 to now everything just about is being assisted for her or I'm doing a lot that I don't even check in with her about. It's just routine. We have a new routine. It's our new normal. Things that I do as well as things the caregiver does. Oh yes, we forgot the dentures. Sometimes you can slip them into your mouth and sometimes you need tape or cream. Did you think about that? Some people can't do it. My mom's never done it, but she's got the care that she needs. So she can feel good about herself, be ready to go out and greet other people, be involved in social activities. Okay, she plays poker 5 days a week. We're talking 97. She plays bingo. She plays Rummy Cube. She'll play whatever you want to play, but she loves card games, and she loves betting. Oh yes, it is about the money. So there's an example of a pretty cool 97-year-old. Not your typical poster senior, although if you see her walking, she is. She used to be 5'2". She's 4'11" now. And of course she uses a walker or her power chair. And watch out for those power chairs. That's a whole nother story. They can go pretty fast. Well, that's personal care. And you can see how important it could be to maybe you have somebody in mind or you're remembering your grandparents and what you had to do for them. It's a lot of work, and it's a lot of work for a family caregiver. Mom did not want to go to an assisted living facility. I did not want to move into her house and manage from there. I was working. I did stop working for a number of years. And a lot of people that are caregivers have that kind of stress and have that kind of routine where they need to be available. Well, I still need to be available 24/7. Oh, is that my phone? Maybe it's Mom. All right, companion care. These are, again, things that you do every day, right? You've started reading over the list. Visits, company, conversation. Extremely important, especially if the individual is in their home. My mom has a lot of friends, and that's one reason I love the assisted living facility. There's people everywhere. Some she doesn't like, and some she does. Some she plays poker with, and some she plays bingo with. And she eats dinner with people. She has a lot of companionship, and she's the type of personality that needs that interaction. Medication reminders, I actually take care of her medication. I go to the pharmacy, I put the pills in the boxes, and the caregiver who comes in gives her the medication. And my mother can take it on her own. She actually knows what every pill is for. And she's very good. She's always been very compliant about medication. We talked about meal preparation, light housekeeping. Wouldn't you like some help doing the laundry? That was one of the best things about having my hip replacement. The laundry was upstairs. I had to have help, and I loved it. Living alone and being an independent woman for all these years, and okay, I'm 64. That's a lot of years taking care of myself. It wasn't a bad thing to have other people take care of me. I didn't need it. I didn't need clean clothes. I wasn't going anywhere. I couldn't drive either. But there's things that have to get done around the house, and you feel better when the rugs are clean, when your clothes are clean, when the sheets are clean, and everybody feels that way. Shopping and errands, just transportation to the doctors. I think we have 10 now. I don't know, there's a neurologist, a gastroenterologist, a podiatrist, an orthopedic surgeon. She fell and dislocated her shoulder, and we met our orthopedic surgeon, the one that's doing my surgery. So that wasn't bad either. I've got a whole list of doctors, and when I need them, they're already lined up. I know them, and they know me. Recreational activities, you know, when I think of my mom, what comes to mind is card playing or the games that we have in her room so that we can access. Mail and paperwork, that's a big job. She gets a lot of mail. I don't know why, but she still gets a lot of mail. I handle that. I handle her finances. I discuss her we meet with her investment advisor. We do that together, which is great. but I help her make decisions about that. That's a lot of work. Grooming, washing, living, and guidance. So those are the kind of activities or services, let's call them services, that you can expect from FirstLight Home Care, definitely, but from a lot of the agencies that are available. And they are springing up all over because the baby boomers are expanding. We're getting ready to need some assistance. And did you know this? The 90 and over population is the largest growing segment of our population. In the last few years, I've been to 3 100 birthday parties at her assisted living. So I'm with 80 and 90-year-olds and 100-year-olds pretty regularly. You know what? They're just like you and me, except they can't do the same things. They're not as independent, although some of them are pretty independent. And some of them need a great deal of help. So I don't know what's in your future, but chances are you will be a caregiver or you will need caregiving at some point. Or perhaps you've already been a caregiver in the past and had that experience. What you need to know about for yourself is that these services are available in home care agencies. And what I'd like to do, though, is for you to carry this information out to the people that you know professionally, particularly the healthcare industry, physicians' offices. Again, I was never told there were agencies that could assist me as I was on my 10-year journey with my mother. And all I can say is, well, that's the past, but what a shame. Thank you. Do you have any questions? Anything I didn't cover that you were expecting to hear?